Back to our lineup of speakers. Give me 1 second. Dr. Nias Mohammed is again chairman of AEC Group and been in medical education for a while. So let me explain.
Good evening, everyone. It's been a great honor to be part of this wonderful event. I would like to extend my gratitude to Dr. Sangeeta, Dr. Chali for inviting me for this event, and all the dignitaries in the dais, friends. I won't extend my speech too long because I think we have crossed the time. I just want to put some things into perspective. Like being a doctor, see, being in India, we have been taught PSM in our curriculum. But medical students don't take PSM as a major subject. They usually ignore it, thinking that this is something related with the rural population. I've been to many of the countries, I've seen the system, and most of the countries, they don't give much of an emphasis into the preventive system of medicine, whereas in India, we have that system. So the more important is that the system should be implemented into the students and made them aware that prevention is better than cure. And my second point, India being a vast country, we have very good infrastructure like the CSCs, PHCs, but it's not being utilized to the optimum. So whereby we always blame that it is the government's job to take these things to the higher level. Whereas when we can contribute private and government partnership, if individuals can take up these things by taking the rural population and the prevention methods, I think that will be a wonderful option for the betterment of prevention. And number three is like now in this digital world, everybody is having a smartphone. So I would like to suggest, like being doctors, we can create some kind of direct relation with the people by sending them short video message, like we all get a lot of medical information, something related to prevention, something related to cure, which might be true, which might be wrong. But if there is a forum whereby short video messages can be directly sent to the people and made them aware, that's going to create a wonderful difference. That's my opinion. And I would like to stop my speech. That's it. Thank you.
Thank you, Nias Mohammed. Dr. Murthy Gokula. He's a CEO and founder of Global Teleclinics, I believe a fellow American from Ohio. Global Teleclinics revolutionizes the healthcare industry by moving the discussion away from sick care. I agree with you 100% over there. They're about to disrupt the healthcare industry through a holistic lifestyle care approach by changing the lifestyle and habits of individuals and families through 6 pillars of lifestyle medicine. Dr. Gokula.
Good evening, everybody. I'll be very brief and crisp. I think I feel like very privileged and honored. I think my moksha is done today, sitting beside Sangeeta Reddy and all the august body here, and all the august people in front of me, audience. And there are brains and beauty also here on the floor. So my job of trying to create global teleclinics, I've been doing telemedicine for 10 years, and people in US thought I was a nut. I wrote a huge grant trying to see how older adults can stay home, blending medicine and technology. And then the grant kind of went south. The university didn't like it. So I was in academics all my life. I was the program director for geriatrics fellowship. And then something that I was missing is trying to disrupt primary care in rural area. And 2016, I resigned. I started Concierge Connected Care. So it's a membership model that I have. So I started doing geriatric concierge connected care. 2 years ago, I learned about lifestyle medicine. The 6 pillars are exercise, nutrition, stress management, sleep, addictions, and social relationships. One of the requirements is you go to an in-person CME. So I looked at it and I thought, let me go to Harvard So I went to Harvard for a CME, and the evidence that they have presented over there just blew my mind. And I said, I'm done. This is going to be a paradigm shift that I'm not going to do disease management too much, but I'm going to do disease reversal. I'm not going to do healthcare. I'm not going to do sick care, but I'll do healthcare. For having done geriatrics for 28 years, that's how Global Teleclinics, blending medicine and technology. Believe in health screening. And during COVID, we were offered a corporate health program, 250 odd patients we served through telemedicine. My admission rate was only 4%. And we did a lot of clinics around. I always believe in publish or perish. And once you do, the only way I've been working with a lot of public and private partnerships, CSR funding, through a machine called HealthCube from Delhi over the last 6 years. And what I believe in is an end-to-end program management. And data is power, as Dr. Shah said. And I believe in that. And how do you actually take that data and measure and then create consequent action? And the way I wanted to do it with rural India is to do a hybrid model wherein you do in-person consultation and teleconsultation, a similar replicative model in US. But we created a lot of lifestyle approach to COVID care. I'm sure there are a lot of data that's published that people who were less obese, people who had less comorbid conditions had less COVID and really conquered that well. And I always believe that corporate people are the ones that are really changing the landscape of health in the urban sector. So I wanted to kind of take that as one vertical, and then I wanted to do my family health and then personal health. And the whole focus is all about lifestyle disease reversal. I'm really not interested, and one of my colleagues was saying here about the cardiovascular disease. Dean Ornish actually presented and published in JAMA probably 15 years ago, heart disease reversal. And I'm actually doing a lot of diabetes reversal in US, and I want to bring that all management to India. So I'm not interested in disease management. I'm sorry you all are talking about disease management. I want to talk about disease reversal. That's the paradigm shift, and that's where technology can come together. And I use an app, and my patients communicate. I do disease reversal programs through app. So I started building a platform here similar to US, and I hope. And my first guess, I always joke around that I may not be a rich doctor, but I'm rich at heart through heartfulness. That's the spiritual practice I practice. And I want to thank Anupama and Dr. Chalil to even think that I was worthy enough to stand here, which I don't think in my mind that I'm worthy enough to stand here and speak to all these people who are so accomplished. But I have a goal. The first year goal is to create 75 villages screening, health